So my name is Matt Suri. A couple years ago, I started Essential Food Safety Consulting after being in the food safety auditing and consulting world for several years. And this is actually pretty cool because I started the company with my business partner, Lisa, who is a family friend from Amsterdam, and she flew in last night to be here today. So there's Lisa back there. And without her, this would not be possible as well. So this is really great, amazing collaboration between us, between the Long Island Food Council, between MTRC. So thank you again, Michael and Cynthia, for the opportunity to speak to you guys here today. So, who are we? Well, we're a consulting company. We help a lot of food manufacturers, producers, packagers, co-packers, in establishing and maintaining their food safety system against a particular scheme, whether it's a GMP program, a straight up HACCP, if someone's just asking, well, we just want to make sure you have a HACCP plan. And now, with the new regulations that we're going to be talking about this morning through the Food Safety Modernization Act, helping everyone get their FSMA compliant, compliant to the FDA regulations and standards that are enacted and are now expected of all food manufacturers in the United States through the Food Safety Modernization Act. So we're talking about that today. A little bit later, I'm going to be talking about SQF and what's new this year in a recent update of SQF, which is edition 8. And then a little bit later on, we're going to touch on Global Gap and Primus, GFS for agriculture. So that's who we are. Also, I have with us Kevin in the back, who is a senior consultant that came on with us just a couple of months ago. And so he's going to be talking a little bit about Primus, GFS, and Global Gap at the end of the day as well. And we'll be fielding some questions and maybe saving some questions for later too, for some really good follow-up conversations to be had after today. So today we're going to run through, again, like I said, Food Safety Modernization Act. So what's new, what do you have to know for FSMA? What do you need to know that maybe you're not sure that you need to know? So we'll talk about that. Okay, so here we go. You guys ready? Yeah, okay. And I'm going to move around a little bit just so that you guys can all see the slides up here. We're going to be making the slides available through the Long Island Food Council. So after this, if you want slides, you can email me, you can email Michael, and we'll make sure we get you a copy of the slides. So food and beverage industry regulations, well, there's international guidelines through GFSI, which is the Global Food Safety Initiative. Underneath that umbrella, if you will, are food safety schemes like SQF, BRC, and FSSC 22000. Underneath that, or I say kind of aside from that, are our regulations that we have here in the United States. GMPs, good manufacturing practices, that were codified into the federal regulations 21 CFR, began with Part 110 for food, is now Part 117, which is part of the Food Safety Modernization Act. And that came out of course, passing the Bioterrorism Act back in 2002, so we're going to talk about that. Preventive controls for human food rule, and I have some slides on foreign supplier verification program, but I don't think we really need to spend a lot of time talking about that today. Just know that it's out there. So what is GFSI? It's the Global Food Safety Initiative. It's a set of guidelines put together by major retailers, major global retailers, because they wanted to know that there was a unified code or expectation for food safety internationally. Retailers like McDonald's, the Walmarts, the Targets, the Costco's, those are companies that comprise the panel of companies that are part of GFSI. Okay, they manage the benchmark food safety standard and different schemes. One of those schemes is SQF. SQF is probably the most popular food safety scheme in the United States right now. I'm going to switch for those of you over there that I'm blocking. SQF stands for Safe Quality Food. The FMI, or the Food Manufacturing Institute, is the company that manages that food safety scheme. We're going to talk a little bit more about this scheme in the second part this morning before the wine and beer panel, okay? You guys can see okay if I stand here? Is that all right? Okay. SQF is also the only scheme that has a quality component to it, so there's food safety and quality. This year, I'll just tell you now as a foreshadowing for our conversation later. This year, the quality aspect of the scheme was they made that pass-fail, and as opposed to scored. But we'll talk more about that later. BRC stands for the British Retail Consortium. This is a food safety scheme, also part of GFSI, or under the GFSI umbrella. And that was formed by a body of retailers in the UK. It represents about 80% of the trade in the UK overall. And it's widely adopted in the in the EU. So SQF's a little bit more popular over here, BRC is a little bit more popular over there. They all say pretty much the same thing with a couple of different nuances, okay? And FSSC 22000, again, along the same lines, they are aligned to the benchmarked standards of GFSI. This format of the Food Safety Code mimics more the language and feel of ISO 22000. So, food safety legislation. You guys up on your food safety? It's a pop quiz. Good manufacturing practices were codified into federal regulation in 1986. Came out of a lot of research into food safety, and kind of along the lines of in conjunction with a lot of advances in food safety, especially with the advancements being made in the space program, with advancements being made. And in collaboration with like Pillsbury, and that's how all the HACCP and all that got codified as well. And so these are the part of all of the food safety that got codified into federal regulations, what we now know as GMPs. Okay. And after 9/11, we realized that there was really a risk here in the United States to our food. There was a potential threat or a potential weakness in our food chain, and so the Bioterrorism Act was passed to make sure that we were able to maintain food safety from a food security standpoint. And then out of all of those further conversations and discussions, along with the strides that have been made in the industry, by the industry self-policing itself, or self-regulating through schemes like GFSI, the Food Safety Modernization Act was born. And that's what we're going to be talking about, the Preventive Controls for Human Food Rule as part of the Food Safety Modernization Act. Good manufacturing, we talked about this. One thing about GMPs that we all know, it's the minimum standard for food safety, right? It's the minimum standard for food safety, and it mentions proper sanitation, proper pest control, proper personnel practices like hand washing, coming to work with clean clothes, not introducing microbiological contamination into the food manufacturing process, those sort of things that we kind of a little bit take for granted that seem like common knowledge for those of us that have been in the industry for a long time, but we had to write them down. I talked about this, that the Bioterrorism Act came in the aftermath of 9/11. The major provision here out of this is that every facility engaged in manufacturing, processing, packing, and holding of food must register with the FDA. So now if you're in the food business at all, you have to register with the FDA, and that enables the FDA to be able to come out and actually make sure that you're doing a good job, make sure that you're producing safe food. Otherwise, now as part of the Food Safety Modernization Act, they have the power to basically close your doors on you if they feel like you're at risk. Yes?
Are there any caps or floors? So who's too small that they exempt from any facility manufacturing?
There's a list on the FDA website. Yeah, for anyone who's exempt from these parts. Yeah. Go ahead.
So you're saying FDA. Now, what about like ag and markets when you're producing under an ag and markets license?
So yeah, it depends on what you're producing and the size of your farm.
Okay.
And so the specifics are on the FDA website. I don't have them memorized off the top of my head, unfortunately. Yeah. Okay. Also, as part of the Food Safety Modernization Act, this is the bit that we're going to be talking about. All facilities have to have a food safety plan, a documented food safety plan. In the past, the expectation was just that you were following these rules. You were just following good manufacturing practices. Now you have to actually have them written down. You have to have performed a hazard analysis and identified the potential threats, chemical, biological, physical, that can enter into the system, and then you have to determine how you're going to control them, okay?
You said documented?
Yes.
Is that your own documentation, or is
It's
that
your
something-
documentation,
okay,
yeah.
not
You have to
approved
create
by
your
somebody
own.
else?
You have to create it yourself, and it has to be performed by or under the guidance and supervision of a PCQI, Preventive Controls Qualified Individual, and that definition is outlined in the code. I'm going to go into that in a coming slide here. So the way that they have it set up is they're saying you have to have a food safety plan written down. You have to have someone who is knowledgeable of the food law, make sure that your food plan is correct. And there's a couple of different ways that if you wanted to, you could become that qualified person. I'm going to go into that in a minute here, okay? And then on top of that, any records, whether it be from monitoring, validation, or verification, have to be reviewed by a PCQI or under the supervision of a PCQI, because you want to make sure that you're keeping adequate records. That way, if you do have to have a recall, you have records to assist in that process. In the past, sometimes there have been recalls that might have needed to be made, and there wasn't enough information being maintained by the company to assist the FDA in the recall that had to be made in order to protect the health and wellness of the general population. Does that make sense? So through the last number of years, we've identified that just as a food safety culture in general in the United States, for the most part, we're kind of missing the boat, but we could have been doing more to help each other out in case something goes wrong, and then protect ourselves from people trying to do something intentionally wrong to the supply chain, okay? I mean, that's the crux of it, in layman's terms. Okay, so what is PCQI? PCQI is a Preventive Controls Qualified Individual. After you take the class, you'll never forget that series of words. What that is someone who's knowledgeable, again, about the food code, and is going to be able to be qualified to help assist you through the whole process of developing, establishing, and maintaining your food safety plan. Okay, so how do you become this person? Well, a qualified individual is someone who's either, this is in the definition of the law, by the way, someone who has successfully completed the training in the development application of a risk-based preventive controls, at least equivalent to that received under the standard curriculum recognized as adequate by the FDA, because there's a whole course, by the way, or is otherwise qualified through job experience to develop and apply a food safety system. So, what does that mean? It means if you're an industry person and you're knowledgeable and you can read the law and understand it, then you're qualified. You have to be able to demonstrate that knowledge to the FDA regulator when they come on site. Otherwise, you can take the course. There's a standardized course that's offered, that has been developed and approved. The governing body that did that was the FSPCA, the Food Safety Preventive Controls Alliance. So there's a standardized course. I'm actually a standard teacher. I've been christened or knighted or however you want to term it. I'm qualified to teach the course. So in the first quarter of next year, at some point, we'll be letting you know we're going to be offering a preventive controls course to anyone who's interested in taking the course. It's a 20-hour course over 2.5 days. Okay. So this is just a course summary of that class that I just mentioned. Okay. The FSPCA Preventive Controls for Human Food course is the standardized curriculum. It's offered by the FDA. So it's the course even the regulators take, okay? Successful completion of the course is one way that you can meet the requirements of being a preventive controls qualified individual and to manage the food safety plan. The course the preventive controls for human food regulation that builds on existing good manufacturing practices, okay, and food safety principles. And it reduces the risk for both business and the public, because if you have a robust food safety plan, you're already going to be doing things in a way that's going to minimize the risk to the general public, and it's better for you, and it's better for them, and it's better for business. It's better for health, it's better all around. It's win-win. Okay? You guys with me?
Yes.
Good. Yeah, go ahead.
If you're in the, say you have Suffolk County Health Department, who handles certificate, things like that, does that count towards some of this stuff? You already have a restaurant, you're serving food, and you mentioned Suffolk County is pretty high.
I mean, any kind of food safety experience is going to help. It's going to help you. It's going to help you understand. I'm going to give you a little bit of a brief overview, kind of just a snapshot of what's captured in the training in the coming slides. And it's good to have a little bit of a background, because it just, every little bit helps. Yeah.
So if you're doing it based on work experience and job experience, how do you vet that to the FDA personnel?
It's just going to be based on the questions that they ask you while you're there.
Yeah, your resume.
And based on the food safety plan that you help develop,
Okay.
and they're gonna, and if the format fits for what they're expecting to see, because in the course you learn a general format of how to lay out your food safety plan, and it's like one of those things where once you learn it, you know what it's supposed to look like. So if the FDA regulator comes on site to review your food safety plan and doesn't have like the look and feel of what they're expecting to see, that's going to be a problem.
From your experience and position, how many businesses on Long Island already have?
Not enough.
Well, I mean,
A lot of businesses don't even know that they're even supposed to have this already.
Yeah, right.
So the deadline for this, as I'll talk about, for very small businesses passed in September, and now everyone's supposed to already have this in effect. And if the FDA felt that if you didn't have it and you were a serious risk that they could shut you down, a lot of businesses would go out of business.
What do you think, 20%?
I couldn't venture to guess. I just know that it's not enough, because when I do talks, and I do have conversations with companies, they were just not even aware.
How do you measure very small businesses?
Very small business is under 500 employees and under $1 million average revenue.
So
That's the guideline based on the
all way down
FDA.
to- All the way down to one employee?
No, that's it. Underneath that, that's very small. Yeah.
For the very small businesses that have one of these plans, one of these documents, is it a 3-page type of thing?
I'm gonna show you. I'm gonna show you in the coming slides. Okay. Before I go into that, though, I'm gonna finish a little bit about what the course is gonna look like. So when we do the course, we give background guidance information on food safety in general. We talk about how you're gonna begin the food safety plan development, and then we organize it into the structure of preventive controls for human food that are in line with the legislation that was passed. Okay, so we help basically shape what you already know into what they're going to be looking for and how they're going to want to see it laid out, because the way the food rule is now builds upon Part 110, builds upon what good manufacturing practices were known to be. Okay, and we accomplish this all through class exercises, and we have mock hazard analysis and things like that, and things that we do together as a group, and then you just take that learning, you bring that back to your facility and help put it together. Okay. The reason why they take this approach is because they're going to focus on, you're basically putting your attention on what matters most for food safety. You want it to be preventative and not reactive. So you're anticipating what problems could arise, what actions you're going to have in place to make sure that they don't, or that when they do, they're controlled within a particular set of parameters. And then moving forward, how you prevent recurrence of those issues once they're identified. Okay? Other examples of food safety systems that you might be aware of that take similar approaches would be through the U.S. Space Program, low acid canned foods, seafood HACCP, juice HACCP, dairy has its own HACCP, the USDA regulations for meat and poultry. These are all similar food safety systems. If you were to fall under one of those food safety programs, then you're not governed by the purview of the PC rule for human food, okay? So for those of you who are familiar with HACCP, this is the basic format of HACCP, right? You do your hazard analysis, you find your critical control points in your food manufacturing process, you set what those critical limits are around those control points, you monitor, and when something falls outside of your parameters, you take corrective action, right? And then it just goes round and round and round. The thing that's different now is that it's not just CCPs. CCPs are part of your process. What they do now is they want to make sure that you are also tracking allergen sanitation and your supplier program with the same, I guess, like fervor and urgency and importance as you were your critical control points. Because what was found historically by the FDA is that most recalls in the United States were caused for one of three main reasons. Either there was microcontamination like salmonella, listeria, botulism, E. coli, those sorts of things, right? Or there was an allergen present that shouldn't have been, like it didn't even belong in there, in the formula, or it did belong in the formula, but it wasn't on the label, and so when someone had said food, they had an allergic reaction, right? Does that make sense? Okay, so, and some of those things happened because of poor sanitation or poor supplier control, were leading causes into those things happening. So when you take all of what recalls were happening in the United States, sorry for the mic breaking, I don't know why it's doing that. They found that by elevating the importance of the allergen program, your sanitation program, and your supplier program, and you're doing your HACCP plan, you're pretty much covered for the bulk of everything, okay? And if you identify a risk that falls into one of these categories for poor preventive controls, then as part of the new ruling, you have to also have a recall plan. So you have your GMPs and your other programs, your food safety plan, and then once you perform your hazard analysis, you sort your risks into what preventive control you're going to use to mitigate those risks, and then if you've done that, once you've identified something, you have to also have a recall plan. Okay? This is just a slide available later so you can compare kind of what's new to what was common in HACCP. And now we're going to talk a little bit about the food safety plan. Anybody have any questions up till now?
How often do you teach the course, or will you be teaching?
At least once a quarter.
Okay.
Yeah. Go ahead.
You had a slide a few slides ago that had some exemptions. It said like FDA, there was a meat picture, there was I think some canned stuff, there was this.
Yeah, that was other food safety, the other recognized food safety programs.
So if you're under one of those recognized food safety programs, does the Food Safety Modernization Act still apply to you?
No, then you fall under that.
Then you fall under that.
Yeah.
And so if you're a meat distributor, say, or a meat manufacturer.
If the USDA has purview over you, and then they're the governing body over your operation.
As opposed to physical.
As opposed to the preventive controls, yeah.
Okay, great, thanks.
Yeah, so like, for example, I used to work for Farmland Foods. So they fall under the USDA, right? And a lot of that depends on what part of the process you're in. Some companies, in a weird way, straddle both, depending on what they're doing under their roof. So, it's best to check,
I didn't see produce over there. I know there's the produce rule which you can speak.
Yeah, there's a produce safety rule as well.
Okay.
Yeah, yeah. We're not spending a lot of time on that today,
Okay.
but it exists. But for fish, it depends. With produce, it depends on if you're repacking it, if you're just storing it and transporting it, because there's the sanitary storage and transportation of food rule. Okay, so you really have to sit and go through exactly what it is that the company is doing and line it up with the rule and see what fits and what doesn't, what's exempt, what's not. It's hard to stand up here and say, like give a blanket statement because somebody might be doing one other thing in there that actually falls under the purview of the FDA. Does that make sense? Yeah.
So I don't know about everybody else, but I work out of an incubator space, right? Where
Yeah.
there's many businesses and doing that. Like, how does that affect? You know, how are we responsible for other people's stuff? And you know,
Right. So this is actually part of what we're moving forward and exploring together, almost as a community, right? So. This is one of the things that we're working with MPRC and Long Island Food Council with, especially with everything going on in Calverton, is how can we, if you're responsible for overseeing that part of the process, you need to have procedures and records for what you're responsible for. If there's some shared responsibility in the space, we want to make sure that between what you have and what the space is doing and is responsible for are covered in procedures. So we're actually looking at what's going to be the best approach for people like yourself if you're in the Calverton space. How are we going to make sure that everyone's covered? That's really the least work for everyone, right? So, I mean, we're kind of in the process of exploring that
all right, so
further in depth, but
it's pretty up in the air then.
But the long and the short of it is, as far as the FDA is concerned, they just want to make sure that everything's covered. That you've done your hazard analysis, you've identified what preventive controls you're going to take, and you have the implementation procedures in place to support those programs. So as long as you have it,
That almost sounds like it should be an incubator requirement.
see, I don't know enough about the Calverton incubator and how everyone partners with each other and who's responsible for what to be able to answer that question right now.
Okay.
But the FDA would just want to know, there's a procedure, who's in charge, who's keeping the records. They're just going to ask those questions. So this has to, I mean, the answer to this question, we have to find it together offline.
Okay.
Right? But it's a good question to ask because the FDA is going to want to know the answer to that question too when they come and inspect.
Well, yeah, for sure. Like, you know,
Yeah.
just as a small business, what you're saying just sounds extremely daunting if I'm now having to deal with 40 other businesses that are working out of this space.
Right, and part of the process and part of the risk assessment for the space is identifying, is that posing a risk are you guys posing a risk to each other and how are you mitigating that, right? So for example, if you're producing a food that contains one of the major 8 allergens identified in the United States and somebody else isn't, what's being done to make sure that what you're doing isn't going to cross contact with anything that has to do with what they're doing?
Right.
You see what I'm saying?
Yeah, well, you know,
And then whose responsibility is that, and whose program is going to make sure that, you see what I'm saying? No, and that's part of what we have to dive into because there's a lot of moving parts when you're dealing with an incubator.
Yeah,
Okay, does that make sense?
Yeah, it just,
Yeah.
it seems like it's over my head or pay grade or something.
I understand.
All right.
I understand. No, 100%. I understand. Yeah, and like when you're dealing with any shared space whatsoever, these are the things that you have to look for, and then make sure that you're accounting for them, and who's responsible for doing what to make sure that one person's this happening over here doesn't affect what's going on over there. Okay. Okay. So where are we? We did that. We did that. We did this. Okay. So when you're building your plan. These are the objectives, okay? So obviously you've seen what the benefits are of having it, the principles applied, and then I'm going to go over the roadmap here. Your food safety plan, in case you're wondering what the definition was, they wrote it into the code. It's a set of written documents based on food safety principles. You're incorporating your hazard analysis that you've done for your process, okay? And you've identified your preventive controls, all your programs, supply chain, sanitation, allergen, etc., your recall plan. As long as it delineates the procedures that are to be followed for monitoring, for taking corrective actions, and continued implementation of your plan and verification. That's all of that, all those things, that's your food safety plan. Okay, and the food safety system is everything else that supports all the other implements. Yep. So here's what's required by law, is they want to make sure you've done your hazard analysis, you've identified your preventive controls, and that you have procedures for monitoring, for taking corrective action, and for verifying the food safety plan. That's what's required. What's useful is having a facility overview, having a description of the product, of the area of the company, of having a product description, your flow diagram, and the flow diagram is going to be your process flow, right? From incoming raw materials, whether they be ingredients or packaging materials, to storage of those, to then pulling them, mixing, blending, cooking, swirling, mixing, whatever, right? And then packing, and then shipping. The whole entire process, labeling the 9, right? Okay, and I mean, this is why. This is some of the reasons why we do this. Because there's a couple years ago, if anybody remembers, 2008, 2009, about 10 years ago, salmonella outbreak in peanut products. You guys remember that? PCA, Peanut Company of America. About 3,900 products were recalled from over 200 companies. 714 ill, 9 dead in over 46 states. This was really, really bad. This is really bad. And this is one of the situations that we want to make sure that we don't repeat as a food culture, food manufacturing culture in the United States. We don't want this to happen to anyone ever again. That's why these laws were put into place. That's why the FDA is monitoring everyone to make sure that companies that know better and should know better are actually following those rules and doing better. And if something tests positive, you scrap it. You don't ship it anyway. That's what landed the guys that ran this company in jail, because they knowingly shipped a product that was tainted, okay? And people died, and that's bad. You guys follow that? You guys agree with that, right? So, yeah. I don't like to spend a lot of time on this because this makes me feel all negative and icky. Yeah, okay. Possible sources of hazards, people, ingredients, and the environment. So when you're doing your hazard analysis, once you have your flow diagram, when you do your hazard analysis, you're looking at what could happen to the food, to the product, to the ingredients, to the packaging, to the process in general. Can the product be affected by people, ingredients, and that's other ingredients, or the environment in a way? So can they be affected physically, chemically, physical, chemical, or biological, right? So you want to make sure that you're not contaminating something with, like, you have one ingredient that's tainted with micro-contamination. You're not going to bring that into the mix and ruin the whole batch, right? Things like that. Again, same slide. Perform your hazard analysis. Identify your preventive controls. Assign parameters and values to those preventive controls. You're going to monitor those, and then you want to have documented, this is important, you have to have documented what the steps are you going to take if you identify something that's not in conformance. That's the whole point. So if it's not in conformance, what are you going to do? And then how are you going to verify that it's back in conformance and that your change is having the desired effect? That's all the verification and validation of your plan, okay? And then you want to document all of that. That's the verification and record keeping. So the scope of your food safety plan. Your food safety plan should be specific to the facility itself. And if you have like 20 SKUs, you don't have to have 20 food safety plans. You can group them into like product, okay? Because you might have cookies and you make like 20 different kinds. It's just a matter of the mixture of the ingredients. Well, you can have, if the process is pretty much identical except for some of the ingredients, then you have one food safety plan, okay? You want to address specific products and processes as part of the product description, okay? And then identify the hazards. So here's our little pretend food safety plan, okay? So this is getting more to the answer of what you were asking me earlier about what should your food safety plan look like. It should look like this. It should be a blue binder. No, I'm just kidding. It's gonna look something like this. You open it up and you have your background information. You have a tab for your hazard analysis, your preventive controls that you have identified, your recall plan, and any other implementation procedures that are going to support everything, okay? So you pull back tab 1. This is your background information. All right, this is useful information to help create your plan, right? You have facility overview, you have identified your food safety team, you've written your product description, maybe you have your flow diagram, your process description, all in there. Any preliminary steps that you've taken to create your plan, you'd have in this part of your binder, okay? Then you go to the next tab where you've done your hazard analysis. This is the part that's going to drive all the decision making for your plan, okay? Conduct your hazard analysis, you identify your preventive controls, and these are your 4 preventive controls. So it's gonna fall into one of these 4 buckets, what I call, right? Your process controls, which is what your CCPs are your process controls. And then any food allergen controls could be from labeling or anything that you're doing to prevent cross contact. Which also could be sanitation, because sanitation can prevent biological and also allergen cross contact, right? So not just cross contamination by pathogens, but allergen cross contact. And then your supply chain. Also labeling is going to support your food allergen plan, right? So you're going to have some procedures that talk about that. And if you're the importer of record, then there's some FSVP considerations. So that's why I'm going to mention the FSVP a little bit, just to make sure that if for whatever reason you are the importer of record, that whoever you're importing from has to have a food safety plan that aligns with the Food Safety Modernization Act, okay? And then any other preventive controls as needed, as you see fit, based on your experience. But it's typically just going to be those 4. Again, once you've identified a preventive control, then you also have to have a recall plan, so that there's a written guideline of what to do if something goes wrong. Because guess why? Because there were times when something went wrong and nobody knew what to do, there weren't records, and you couldn't alert the public or the consumer or somebody else that might have been affected because they didn't know who they shipped it to. They're like, yeah, we made a bunch of it, we shipped it to a bunch of people. Well, who'd you send it to? Nobody wrote it down. She was sick. They didn't know that they had to do that. These were problems that were happening out there in the real world. So now we had to make it the law so that we all do this stuff. Does that make sense? Okay. And then, like I said, all the other implementation procedures. Any validation studies that were used to justify how much a hazard might affect it, like what's the likelihood and severity of a particular hazard. Maybe you have a validation study that shows that something could happen, but it's not likely to be a hazard. So you want to have that also documented. Okay, so that's basically your food safety plan, okay? You have a written food safety plan, it's specific to the facility, and it has to include a hazard analysis. If in the hazard analysis you identify something that is going to require preventive control, you want to identify what category it falls into, whether it's your process or food allergen, sanitation, or supply chain. And you also have to have a recall plan once you've identified any hazard, okay? Make sure you have other procedures that are related to monitoring and verifying that hazard, okay? And validating the effectiveness of the food safety plan. The format's flexible, but you have to have all those things. Like, it's not like the FDA is going to come in and give you a hard time if your sections are out of order. You want to just make sure you have everything available for review, okay? So like I said, the timeline for the PC rule, it passed for even very small businesses just this past September. So now even very small businesses that are making less than $1 million in total sales are required to comply. Questions? Any questions on this so far? Yeah.
You seem to be talking about people who are selling food wholesale. This applies to people like restaurants, or you're selling food at a farm stand, and food trucks?
Food manufacturers.
Food manufacturers.
Yeah, anyone who manufactures, processes, packs, holds, distributes food in the United States.
So restaurants are not.
Restaurants, no, because they fall under a different set of guidelines. Yeah, yeah, for retailing food.
So, as an example, potatoes into potato chips, tomatoes into spaghetti sauce, beer and wine out of grapes and barley.
Yeah, I mean, there's some little nuance when it comes to beer and wine that we're going to talk about later. But yeah, for the most part, it's centered around food production. Yeah, there's a little bit more with some produce safety, and there's that's where we have to get a little specific and find out what exactly are you doing with your produce, so we find out exactly where you're delineated. Yeah, go ahead.
What about for food banks?
For who?
For food banks.
For food banks? Food banks, that's a good question. We're working with, it's Feeding America, right? Huh? Oh, Island Harvest. Yeah, sorry, Island Harvest. Yeah, that's you guys. Yeah, so we were working, so Kevin was over there to help you guys with your sanitation report. Yeah, because that would fall under the storage and distribution of food. So you want to make sure that you're preserving the integrity of the food safety of the items from the time that you get them to the time that you distribute them. And that you know who you got what from, all that, and then who gets it, right? So that way if there's a problem, you know who can be contacted. Because if a recall is done, let's say I have Matt's Meat Sauce Company or whatever, and I donate my meat sauce to you, okay? I find out that there's a problem, potentially. I'm gonna tell you, hey, all that meat sauce I gave you, whatever you've done with it is bad. You have to pull it, throw it out, send it back to me, dump, whatever. Right, so if you've given some of that away, you have to be able to know who to contact in case there's a problem, right? So like somebody else got sick, they called us. What we tested was good, but we want to make sure anyway, so you see what I'm saying? So there has to be a proper, chain of custody. It's like playing the telephone game, right? So we want to be able to tell someone, hey, don't eat that, just to be sure, right? Yeah. Okay. Real quick, food safety verification program. All that really I'm going to say about this is basically what's on this slide, okay? All foreign suppliers for human food and animal consumption must meet FDA food safety standards if it's going to be brought into the country, okay? For the most part, you're going to be dealing with distributors and brokers who are the importer of record, and they've already done the legwork on this. Anybody here importer of record for anything, any raw material, ingredient, anything? I didn't think so. But this is the big part of why we're doing what we're doing. When I say we, I mean as a country, right? Is because the government wanted to make sure that any food that we're bringing into the country to feed our citizenship, right, that it follows this set of food safety standards, because we don't want to poison ourselves, which we have a tendency to do from time to time, unfortunately. That's why these rules are in place. That's why we're in this business, just to make sure we keep everybody safe, right? Because food's supposed to be fun to eat, not like, it's delicious, but I hope I don't die. It's not supposed to be that way, okay? Michael, can we ask them, this keeps cutting out. Can we see if it's a battery issue, or do you think it's a volume issue? Maybe ask someone upstairs. I probably am. You want to give us a commercial break? What's the time, by the way? What's the time? I know we have. What is it? Okay. I did want to talk a little bit about SQF, but I actually do want to give my voice a little bit of rest for like just a minute here. Does anybody have any questions about what we've covered so far regarding the Food Safety Modernization Act? Yeah.
Just right in the foreign import part.
Yeah.
Basically, if you're the legal distributor or handler when it comes here, you're assuming the liability for what happened to import that, right?
So, I mean, is that something that you do?
No, not at all. But
Okay.
I'm just curious because there's not really much inspection on the seed, right?
Right, well, the importers, what they're doing is, for the most part, they're getting all the information from the supplier to make sure that they have a food safety plan that's in line with the Food Safety Modernization Act. Does that make sense?
Yeah, but how do they enforce that?
They get spot checked.
Okay.
The unfortunate fact is that there's not enough FDA regulators to check everybody all the time. Some companies don't get inspected by the FDA for like 2-3 years, sometimes in between visits. Some companies that are higher risk get inspected more often. It's based on risk. It's based on complaints that the FDA is getting. You know, it's kind of, and the whole system is evolving as we go forward, yeah.
Is a 2 to 3 year period between spot checks, is that the normal range, or?
It depends, it depends. It can be once a year, it can be, I've heard of a 4-year gap before with someone, it just depends.
So you bracket it for us. So
I'm just giving you about what, through my personal conversations that I've had with manufacturers about how often they're getting inspected. You know, I mean, the thing is that the FDA is approving some third-party certification bodies to start doing risk assessments of companies based, you know, using an audit outline that covers basically the format of the PC rule for human food. And then those results are being shared with the FDA, and they're using that to do a risk assessment on maybe where they should send regulators in an order of priority based on risk, based on these assessments. So kind of the whole system's still in flux right now. Rule of thumb is just do what you're supposed to do and you'll be fine. And then it doesn't matter how often they come, because you're gonna have something in place. Yeah.